This is Pharma Forum web editor Nicole Raleigh, and I am on site at ESMO 2024 in Barcelona. And I have with me Dr. Meredith McKean, Director of Melanoma and Skin Cancer Research at the Sarah Cannon Research Institute. Welcome, Meredith.
Thank you. Thank you for having me.
So at this year's, let's go an event backwards, at this year's World Conference on Lung Cancer, or the WCLC, there was 5-year survival data that was presented on Libtayo, a PD-1 inhibitor, as a first-line monotherapy in advanced NSCLC. Here at ESMO, longer-term results with investigational fianlimab, which is an LAG3 inhibitor, plus Libtayo, form a part of an initial trial in advanced melanoma. And that's been presented, high clinical activity. Please tell us more about this different application.
Yeah. So, melanoma we know is one of the most immune responsive tumors. And so I think there's always a lot of excitement to see how well can some of these novel agents help our patients with metastatic melanoma. So at ASCO 2023, there was initial results presented of this multi-cohort expansion study. There were 3 cohorts, and then 1, which was patients in the frontline metastatic setting or second line that hadn't received prior anti-PD-1, and then 2, which was a second cohort of patients that were frontline metastatic, and 3, the patients that had previously received neoadjuvant or adjuvant therapy and were now under treatment in the metastatic setting. And so the results presented here at ESMO 2024 were additional follow-up from the analysis that was presented last year. And I think there's been a lot of excitement just to see, as a combination approach, how can we improve on just anti-PD-1, which has high response rates and is well tolerated.
Brilliant, yeah, excitement indeed. So fianlimab and Libtayo, this combination, it's being further studied, isn't it, in an ongoing randomized placebo-controlled blinded phase 3 trial versus pembrolizumab in previously untreated, unresectable, locally advanced or metastatic melanoma. So that was actually revealed at ASCO last year in 2023, wasn't it?
Correct.
Okay, and how does all this show a positive step in the right direction in terms of treatment possibility in the sort of, as it were, entire melanoma space?
Yeah, so the results that were presented here at ESMO 2024 was additional follow-up from the data that was presented last year. So we're now seeing across all those patients that were anti-PD-1 naive in the metastatic setting, we saw an objective response rate of 57% on the blinded independent central review. And so that was really sustained from what we had seen previously presented for the investigator assessed objective response rate. And we saw a deepening of the complete response rate to 25%. Also importantly, there was no new safety signal. And so I think because of that excitement of, a regimen that is really well tolerated, we're seeing persistent objective response rates, deepening complete responses, which is ultimately what we want for our patients. I think it was because of that excitement. There's been studies launched, randomized studies now in the frontline setting and adjuvant setting with this combination.
So excitement for oncology, excited possibilities for patients.
Yes.
And are you able to discuss why, with all this collaboration, whether that be with patients, with HCPs, governments, or biopharma companies or other industry partners, why is collaboration critical for cancer care transformation?
Yeah, I think there's just it's so challenging to find effective, tolerable therapies for patients, but we all work together as a team. This is really a team effort because at the end of the day, we all want to help our patients live longer, and we want to minimize the side effects that it takes to get patients to, potentially a disease-free status, right? We love to tell patients that you're cancer-free. And so this can't be done in a silo. And so this is a team effort between, what do patients need and what do we hear from patients to their providers, and being able to see the impact of those side effects and how best to manage them, to our pharma partners that are developing these novel agents, and maybe looking to patients and providers to understand where's the best place for this, and then looking to our government and healthcare agencies to say, okay, where do you think that cost-benefit analysis fits, and how can we demonstrate to you what we see and feel in clinic that this is beneficial for our patients, and so what will it take? What is that bar? And so I think it's really a team effort to try to advance care for patients.
As you say, this de-siloing and the patient voice and multiple voices all together. And for Regeneron particularly, this is important in this acceleration, as it were, to better outcomes for patients, because Regeneron aspires to turn revolutionary discoveries into medicines that can transform those lives, as you were saying, of real people impacted by cancer. And this is the ethos of ESMO overall. So tell me, what have been the highlights for you? Any takeaways, any insights that you care to share at ESMO 2024 in particular?
Yeah, so I think probably some of the most exciting highlights we've seen so far, our goal is we'd love to prevent patients from even getting metastatic melanoma, and you see that with some of the randomized trials ongoing, including one with fianlimab and cemiplimab for patients in the adjuvant setting. And there was some data presented here at ESMO looking at a compilation of neoadjuvant studies demonstrating some of the distant metastasis-free survival, some of those longer-term outcomes that we've been looking for, and additional data for NADINA, which was another neoadjuvant study initially presented at ASCO. And so both of those studies are giving us even more comfort in the neoadjuvant setting to say, for patients that we know are high risk for recurrence, should we be giving these medications, these immune checkpoint inhibitors, even earlier before they undergo surgery? And here at ESMO, we've seen longer term outcomes that's giving us more reassurance that not only are we seeing kind of early responses at time of surgery with pathologic response, but it does look like we're preventing recurrences, and patients that do well early continue to do well later. And so that's really reassuring and showing us we're on the right track.
Brilliant. Thank you, Meredith. It's been a pleasure.
All right, thank you.